My name is Jessica Price and I'm the Director of Safety, Quality and Performance. I am delighted to welcome you to the Sir Charles Gardner Osborne Park Healthcare Group, also known as SCGOPHCG, as a consumer representative. Consumers play a central role in what we do at our hospitals. We are committed to genuine partnership with consumers in the development, implementation, evaluation and governance of our services, as well as the delivery of patient-centred care to the West Australian public. I'd like to take this opportunity to acknowledge the Noongar people as the traditional owners and custodians on the land on which we work and pay respect to their elders, both past and present. North Metropolitan Health Service recognises, respects and values Aboriginal cultures as we walk a new path together. The Sir Charles Gardner Osborne Park Healthcare Group comprises of two hospital sites, Sir Charles Gardner Hospital and Osborne Park Hospital. Charlie's is one of Australia's leading tertiary hospitals and comprises of more than 600 inpatient beds and treats more than 500,000 patients each year. SCGH also includes additional care with contracted private hospitals such as wards at Hollywood Private Hospital and Joondalup Hospital. We now also provide care at home for consumers, and this is known as virtual health care. Charlie's provides a comprehensive range of clinical services including emergency and critical care, orthopaedics, general medicine, general surgery and cardiac care. It is home to WA's only comprehensive cancer centre and is the state's principal hospital for neurosurgery and liver and renal transplants. I'll now hand you over to Renee DePrazer, the Service Director of Osborne Park Hospital, to tell you a little bit about that site.
Thanks, Jessica. My name is Renee DePrazer and I'm the Service Director for Osborne Park Hospital, and I'm excited to welcome you as a consumer representative to the Sir Charles Gardner Osborne Park Healthcare Group. Osborne Park Hospital, commonly referred to as OPH, provides specialist healthcare services for the community in the North Metropolitan area. The hospital has close to 200 beds and treats approximately 100,000 patients every year. Our patients are generally accepted into our care via an appointment, by referral from a clinician or directly from Sir Charles Gardner Hospital, which is our partner hospital. There is no emergency department at OPH. I'll now hand you to Jo Reid, Chair of the Partnering with Consumers Committee, to introduce the governance of our services to you.
Thanks, Renee. My name is Jo Reid and I'm the Nurse Director for Corporate Nursing and also the Chair of the Partnering with Consumers Committee. The Charlie's Osborne Park Group is organised into 5 divisions: acute services, cancer imaging and clinical services, surgical services and specialty ambulatory services, as well as allied health. Except for allied health, which has a single director, each division is managed by a medical and a nursing co-director. The Peak Governance Committee is the Charlie's Osborne Park Executive Committee, which includes the executive team and the chair of the Community Advisory Council. There are a number of clinical and corporate governance committees that sit underneath the Executive Committee. The Consumer Advisory Council is a committee entirely made up of consumers, supported by a non-voting sponsor, whose role is to provide advice to the organisation and advocate for the consumer experience to the Executive Committee and the organisation as a whole. Our hospital group is committed to including consumers like you on our governance committees. The orange hand icon on our governance committee structure denotes those committees with consumer membership, and we are continually seeking ways to increase and improve our consumer partnership. Beyond membership on committees, consumers are invited to engage in projects, take part in reviews of when care doesn't go to plan. Consumers also engage with our services through the provision of feedback. Our Charlie's Osborne Park Group uses a variety of indicators to monitor and review consumer feedback. These include My Say, Care Opinion, and the complaints and compliments received via the Consumer Liaison Service. As a consumer representative, you may be asked to review some of these indicators to help understand the different aspects of consumers within our hospital group. Thank you for your time today. If you have any questions about the content you've been provided, please feel free to get in touch.